That's number one. You kind of reset your
painful, tender to the touch. May also
same shoulder length and the other. Hey everybody, welcome back to another episode of the Real Health Podcast with Brandy and Amir. I am Dr. Amir Rashidian, a chiropractor, and Brandy Rashidian is my other half, as well as the boss and the host and
co-host,
the brains, the co-host, the intelligence partner in everything. And so today we have some articles we want to talk about, and we do have guests joining us in about 2 weeks, I believe. So don't hold me to it exactly, but we do have the guests confirmed, and you'll love these guys. And we'll tell you more about them later on. But the Real Health Podcast is where we take the latest information from mainstream media, and we want to talk about it. We're going to read it for you. We're going to summarize it, tell you what it means, how you should apply it to your life, with the purpose of helping you feel better, get stronger, live longer, and feel younger. And so how's your stress level today?
Pretty good. I feel like, I think we mentioned I'd been a little bit stressed more than usual, but I guess we can officially announce the big announcement comes this weekend, but I've officially started back into real estate. So we're announcing that this weekend at our client appreciation for my brokerage. So I get to now do two things I love, which I'm so excited about. So, and I'm also excited it's fall finally. So I get my sweater on. I've been eating soup. I'm happy. This is like my season. I love it.
Nice. So you won't get a round face.
I'm trying not to get a round face, but I will not blame it on cortisol if I do. So
you'll know why that's our first article. I gave some blood this morning. I had blood test done.
How'd that go?
So yeah, it went well. She did a good job.
Good.
Yeah, 3 vials.
Woo.
But so I get my blood tested every 6 months. And looking at all my
markers,
enzymes, markers, panels, just for health reasons. It's really good to stay ahead of these things.
It is.
You know, maybe I'm a little bit overboard, but there's certain things you don't know if they're working properly
100%
without checking them. So it's funny, I check my blood sugar levels every Sunday morning. I check my own blood pressure and pulse, and then blood tests every 6 months.
I think it makes sense though, because if you think about all the things we do maintenance on, most people do maintenance on their HVAC. Go Winbrook. Most people do that, right? We don't even think about it because we know if we don't check it, then there could be something going on behind the scenes that we don't know about. We could very inexpensively, in most cases, fix that pretty quickly. But if we wait and we just let it go, that wear and tear gets greater. And then the cost to fix that gets higher, right? The amount of time it takes to fix it could be longer. It just becomes more involved. So I think if we treated our bodies as well as we do our HVAC systems in our house, our car, because we all take our car in and get the oil checked and changed, right? It's like one of the things you do, because if not, you could be stranded on the highway. But we never view, I won't say never, but most people do not view their bodies in the same way. We just use it and abuse it. We put crappy things into it, right? We're doing like unleaded fuel when we should be doing premium. We don't do that. That's the food, guys, and the water we're eating. Like we have to be more cognizant that this is literally the only body we have, barring any bionic, additions.
This morning, our middle boy asked to eat something, and you said, we're not eating that anymore. That has a lot of bad stuff in it.
Yeah.
And he said, I've been eating it my whole life and it hasn't done anything. Why do I need to stop?
Oh, yeah.
And I mean, that's such a common statement from everybody.
It is.
Someone will say, oh, I've been smoking for 20 years. I haven't gotten any cancer. This is fine. I've been living like this all my life. Yeah. So I don't need to change.
And it's also, I wanted him to see too, sometimes we don't have the full information, right? Sometimes what we think we know, then we get a little further down the road. We're like, oh my gosh. I mean, how many times do we hear it from patients? All the time. Like, gosh, if I had known this 10 years ago, if I knew that when my kids were little, if I had but you can't beat yourself up because
Yeah.
you only know what you know at the time that you know it.
Right.
And then you have to be willing to make those changes regardless of how hard. It's really hard to have your 11-year-old challenge you on what they're putting into their body, right? And I make sure that we have those conversations because I'm not with him 24/7. We've homeschooled in the past. We don't homeschool right now, so he's away at school. He's, at friends' houses or, at sporting events, and they have choices that they have to make every day. I don't know, maybe I'm a little bit of a helicopter, parent. I try not to be, but we're in a season now with the kids being older that we can have those conversations and go, let's talk about what that really does to your body. So I didn't know about this ingredient. I didn't know. I was looking at this, and this on labels. Now I know this does XYZ to the body. I can no longer in good conscience, let you have that. So let's talk about why. And then I have to educate him. And then he gives me pushback because he is my child. He's me. So I know that there's going to be that fight. And I'm willing to have that with him. Now, in the end, I'm mom. I'm not going to buy it. I'm not going to have it in my house. You really should not eat it. But if you really want to get colon cancer down the road, then you have choices to make. So, and he literally has to make that choice when he's not with me. I'm not going to give it to him, but he still has to make that.
You said there was an ingredient that increases chance of colon cancer by 700%.
No, that is in hot dogs. So this, I just pulled the study. I heard this on a video. And whenever I hear things on videos, just to let you know, I always dig in. There's a lot of information out on the internet and whatnot, even in news articles. We know not everything has foundation. And so not only do you have to look for the evidence of that, then you have to read that evidence. Who created that evidence? Like, who's that coming from? Who's it benefiting? There's so much that goes into it. So there was somebody who was talking about kids' health, and they're like, why are we want to feed all these kids ultra processed food. We want to give them chicken nuggets nonstop. And then when they have high cholesterol, we want to put them on a medication. So in this study that I found, this woman was stating, or in the video that I watched, this woman was stating that, we give these kids things like chicken nuggets all the time, right? And there's a lot of kids who won't eat anything else. And then they end up with, get them diagnosed with high cholesterol, right? And then we want to give them the medication for high cholesterol, which then makes them dependent on that probably for the rest of their life because they don't know better. And that alters their health as well, right? And then she goes into talking about hot dogs. She goes, hot dogs, they're so fun, right? Well, if you give a child 12 hot dogs a month, which is, I dare to say, only 3 a week. 3 hot dogs a week seems like a lot, but I'm just saying. So 3 hot dogs per week.
Eat 3 in one sitting.
Correct. I mean, I would venture to guess there's some people that eat a lot more than that in one sitting. And I'm not going to lie, I was a lover of hot dogs. Like, I know what they're made of. I did that research. I still loved the flavor of hot dogs. I know it's weird. Judge me if you will. I do not eat them often at all. And I only do organic because it freaks me out because I do know what's in it. But so she said that giving a child 12 hot dogs a month increases their chances for leukemia or lower brain tumors by 700%. 700%. Now, I will tell you that this person also then did some research, the person showing the video, and they had noted that there are many school systems that actually have hot dogs on their menu twice a week. I am certain there's still an increase in carcinogenic activity even at 2 a week. It's not like you can have up to 3 after
Right.
3. That's where the problems lie. There are still problems with lower amounts, but maybe not as much. But
It just takes longer to get cancer.
700%.
Yeah.
That is way too much. So now I'm not going to talk to Ramin this week about hot dogs. No, I'm kidding. We don't eat tons of those, but it's on like a very minor rotation. So guys, processed food.
Yeah, we one of my friends, one of our colleagues took a piece of a hot dog and sent it to the path lab.
I don't want to know.
and the results came back as a teratoma.
I know. I can't talk about it.
Teratoma is a tumor that has teeth and hair in it.
Sean, do you want to put up an image of a teratoma?
Let's not do that.
It's very frightening.
No.
It's very frightening.
Yeah.
Anyway.
Just put up a picture of a hot dog, and that's what it is.
Sorry, I have the EVG.
But you can always look it up. Teratoma. It's a tumor found in certain people. It's usually benign, but it's disgusting.
It's ugly.
It has teeth and hair and skin in it.
Well, because it can be any.
Yeah. Which means some hot dogs have teeth, hair, and skin.
I can't.
Oh my gosh.
You were?
No, I said, could you imagine?
Oh.
Yeah.
I was like, ooh, we just found out
they
something about
literally
Sean.
eat hundreds in one sitting. And
Okay.
I don't think they chew those things.
I can't get the image of a teratoma out of my head. That's the problem, is I've seen that before.
Yeah.
So now that's all I
Well,
see.
we had to study it in school. So, all right, why don't we
Okay,
get to our first
jumping in.
article? So that was fun. Listen, if
and
there's-
horrifying at the
we
same
didn't
time.
mention any brands of hot dogs, so we're not gonna get in trouble.
Somebody did behind the scenes, but I don't think that was caught. I really love it when Sean starts talking
I know.
off
Yeah.
mic.
Oh yeah, he's part of the show. So thank you for
Valuable
that.
input.
Comments are welcome. And so this is from New York Times. I think today's like a New York Times day because most of my articles came from New York Times.
Well,
This one,
sorry
the
in advance.
title is "Can Stress Really Give You a Round Cortisol Face?" Online influencers claim the hormone can change the shape of your face, but experts say that misconstrues how cortisol works. Now, I know that people who get a lot of cortisone injections can end up having what's called a moon face. There's also Cushing syndrome that can lead to that. It was a disease, autoimmune issues and so on, but which is high cortisol. And
Right.
tumors that secrete a lot of cortisol can lead to people having a expressionless round face. They call that a moon face. Looks
Right.
like the moon.
I will tell you that the images that I looked up through Google when I Googled this, and most of those images that you see, that's not moon face. That's just somebody who's carrying a little extra weight, somebody who's looking a little puffy.
Yeah, that's true. Moon face is
so-
a serious pathologic thing. So it says hundreds of lifestyle and beauty influencers have claimed online that they've transformed their appearance by tackling stress. Many are sharing before and after photos that contrast their once fuller faces with new lean jaw lines, attributing to the difference to lower levels of cortisol, the hormone produced in response to physical and mental stress. It gets produced in other stresses as well, but some are even selling products and programs they claim will reduce cortisol and lead to a slimmed down appearance.
I want to know what these influencers were doing to tackle stress.
Sounds stressful.
I will tell you that the majority of the population does not even have a definition of stress.
Read my book.
Like, let's define it. What is stress?
Yeah, stress is a force that causes change in your life.
Okay. So I don't know if that's something you want to tackle,
Exactly.
right? It's not,
Yeah.
it's not an opponent.
No.
It's not something, you're not fighting against stress. And I think
Right.
that's part of the issue, is that's the common thought process.
In
So
fact, studies have been done in animals and single cell organisms, microbes.
Right.
And when they remove stress, they die. They literally die early. They don't even live their normal lifespan without stress. It's like taking gravity away.
Right.
Your bones and your muscles would be so weak, they would crumple. They
Right.
would, anything that hit them would break. Gravity is a stress on your body, and it makes your body respond. It's called adaptation. You adapt to stress. So the less stress you have, the less adaptive powers you have, the less resilient you are, the more susceptible to illness and injury you are. So the goal is never to reduce stress.
right.
I'm on my soapbox. I don't know if I'll step off today.
great. It's a good
I'm
box.
staying on this box
It's a
right
good
here.
box.
It says when she began experiencing visible swelling of her face and abdomen in 2020, Miss Zargami consulted a doctor who suggested stress might be to blame. She felt frustrated by the response. How can I control my stress if you're not giving me tools? She wondered.
Okay. I want you all to know I almost threw my pencil or my pen when I read that. I was so irritated by that comment because it shows the general mentality that we want things handed to us. This is the problem that the reason why we're in the healthcare challenges that we're in as a society is because the vast majority of people, most of them are not our listeners, because if you guys are listening to this, then you're wanting to research, you're wanting to listen to people who are taking you down pathways for you to research further, right? We're not saying take everything we say as fact. We're saying, let us present another perspective for you. Now you go research and see which side of the coin you want to be on, right? Because it's all about choices. But when somebody says, how can I control this if you haven't given me the tools to do so? Okay.
And keep in mind, the reason she went there is because her belly looks bigger and her face looks chubby.
Okay, so the first thing I want to say is if those are the two things that are happening, there's already things in your life and your lifestyle that you should begin evaluating. It does not take a physician to help you evaluate if you are putting fast food or ultra processed food into your body every single meal and you're never putting anything fresh, meaning fruits, vegetables, fresh meats, if that's what you're eating. That could be one contributing factor. If you're on pharmaceuticals, why don't you look at the side effects or the effects of that drug, whether it's common or uncommon, because there are
please read
still
the
effects.
fine print. You know those
Yes.
little piece of paper that come with your drug bottle? Of course, the prescription drugs don't even put those in there. They
Yeah.
don't put the inserts in there.
Yeah.
They open the box, they count the pills, they put in a separate
Yes.
bottle for you. I wonder why they do that. Why aren't you getting the manufacturer's insert and box when you get prescription drugs?
It's important. It's important.
There's fine print in that, and they'll tell you all the side effects.
So don't be one of those people who go, why didn't you give me the tools? Because you are the only one who is 100% responsible for your health. Only you can be. And so expecting somebody else to do it when they may have different values, different goals, different perspective, different education. There's so many things that you may not want to live the lifestyle of that person giving you advice.
Yeah.
So be choosy about where you're getting that. But for the love of Peter, it's all you. You have to take that responsibility.
She's 28 years old.
Which is old enough.
Her first name is Mandana Zargami. And I believe she's probably from the same country as I am.
I was going to say, you said that very nicely, which means...
Yeah, and I didn't even pronounce it correctly. I think it's Zargami, which is...
I cannot do the GH.
Yeah, Gami.
Yeah.
So Miss Zargami made lifestyle changes that she believed had reduced both her cortisol level and her persistent facial swelling. These include drinking diluted apple cider vinegar after waking and then green tea throughout the day. She also stopped weightlifting and instead started doing low-impact exercise and walking.
Oh, Lordy Ben.
Unreal.
Okay, so can we just address that? A lot of that sounds like some of that loss comes from diuretic activity.
Correct.
So
That's what tea does. Tea is the strongest diuretic. Tea is stronger diuretic than coffee. And so
Dandelion's pretty darn
it's green
potent.
tea, but tea has thiazide in it. Hydrochlorothiazide is a drug. It's a diuretic that people take for high blood pressure.
And if you're weightlifting, please, I mean, unless there's like a physical reason
doing it
why
wrong
you shouldn't,
yeah.
That is the one thing you should not be removing from your lifestyle
In fact,
routine.
low intensity, long duration cardio increases cortisol levels more.
Exactly.
I mean, look at the data. But anyway, so we love some of these articles, don't we?
Yeah, we do.
Who writes this? I'm not going to tell you who it was. Her name is here. Experts, however, are skeptical that there is anything to be fixed. It's true that chronically high levels of cortisol can affect your appearance, but only in rare cases. The idea of cortisol face is based in a misconception about how the hormone most often affects the body, and experts said is most likely a reflection of society's growing preoccupation with how we look and how stressed we feel. So let's talk about the role of cortisol. is known as the stress hormone because it regulates the body's response to perceived threats, whether that's physical danger or pressure at work. It's vital for regulating blood pressure, glucose, and metabolism, and for many other crucial bodily processes. Literally saves your life during emergencies. Cortisol is what saves your life. But its association with chronic stress has earned the hormone a bad reputation. It is not a bad hormone. Online, people have singled out high cortisol as the cause of their fatigue, stomach, bloating, dull skin, and more. Cortisol levels naturally fluctuate throughout the day. Actually, so ideal. It's not that they fluctuate throughout the day. You should have the highest level of cortisol first thing in the morning. In fact, when your cortisol levels reach a peak, you wake up. Those are the people that wake up without an alarm clock, because that means their cortisol level hit a peak. They wake up, they can't go back to sleep. It's time to get up, and they just get out of bed. Now, if you're waking up at 3 in the morning, you can't go back to sleep. That's a blood sugar issue. We'll talk about that another day. Cortisol, high in the morning, it needs to drop down gradually throughout the day and level out at the bottom at the end of the day. Those are people who can fall asleep pretty easily.
Right.
People who cannot fall asleep at night, they have trouble falling asleep, that's probably because their cortisol curve is reversed. It maybe dropped and went back up in the evening. That's why a lot of experts say don't exercise late in the day, because intense exercise or going for a jog can increase your cortisol levels right before you go to sleep. So you have to wait till it comes back down before you can sleep again. So anyways, it says naturally fluctuates throughout the day. Well, it needs to drop throughout the day, temporarily spiking in response to stress and other triggers like lack of sleep, alcohol, and too much salty or sugary food. That means you might wake up with a subtly puffy face the morning after an intense day or a big night out. Oh, my goodness. But your body has ways of keeping cortisol in check, and most often the effect will pass with a return to healthy routines.
Okay, can we just highlight that? Because so often we do not hear experts saying your body knows how to do this. So what he just said is your body is already has it in its programming where it knows where cortisol should be at certain times for your bodily functions to occur normally. Now, what we do to our bodies throughout the day can change that normal programming. So again, it's not that the body is not able or doesn't have the knowledge to do this. It's that our lifestyle habits change that normal programming. So how we're sleeping or lack thereof, allowing ourselves to respond to stress in a negative way. Like, and we all do it, right? Something happens with the kids, cortisol shoots up, right? Sometimes it's something that you can't help, but there are things you can be doing to help reduce that. Breathing exercises are a great way, right? To help control certain functions in the body.
A long, slow exhale.
Right.
Breathe in quick, and then call it a sigh of relief.
That's awesome. I like that.
Yeah,
Because
lower
that's really
cortisol
what it
right
is.
there, yeah.
Right. So just know, body knows. It's often what we're doing on the side that's making those changes. So.
All right. So this is a doctor, Dr. Rajita Sinha. It would have to be very, very high levels of stress for it to have a more visible non-transient effect. And she is a licensed clinical psychologist and director of the Yale Interdisciplinary Stress Center. Many of the transformations shared in cortisol face posts seem to reflect weight loss or gain, or the fat pads of the face migrating with age.
I would like some fat pads to migrate someplace else. Is that a choice?
Facial swelling. I'm not going to make a joke about that one. Facial swelling can also be caused by a variety of other issues. It can be tied to the lymphatic or circulatory system, an allergic reaction or sinus infection, or simply sleeping or lying flat on for a prolonged period, which can cause fluid to pool around the face. See, now that makes more sense. Then you stress that today and tomorrow your face is fat, That doesn't make any sense. Medically, high levels of cortisol are distinct from cortisol that's simply elevated and must be diagnosed through blood tests. In one rare but serious condition known as Cushing's syndrome, the body overproduces cortisol, which can lead to a swollen, rounded face in addition to other symptoms. Cushing's is usually caused by taking steroid medication for another condition. Like people have like severe arthritis or autoimmune arthritis, like rheumatoid. It says less often a tumor, so it's overuse of cortisone, not unhealthy lifestyles or day-to-day stress, said Dr. Roberto Salvatore, an endocrinologist and medical director at the Johns Hopkins Pituitary Center. I suspect most people who have a round face don't have Cushing's syndrome.
I would agree.
Anyways, it says it's very common practice right now to say my hormones are the problem. This was another person who said that. Yeah, we do like to blame hormones on a lot of things, but you know,
If it's not hormones, it's DNA. That's
but
our two
but your
number one
hormones are a response
Yep.
to your environment
Correct.
as perceived by your nervous system.
Yep.
So when a hormone goes up, you take something to lower it. Why don't you remove the stimulus that caused it? Get rid of all your kids who want to eat hot dogs.
Oof.
All right, next. This is a fun one. New York Times again. Is it safe to refreeze food and other food safety questions answered? It says that, so this is in quotations. Someone might be asking, that salmon I thawed on Monday, can't I just slip it back into the freezer? Those beans are on their second reheat. What happens if I make it 3? Thankfully, the U.S. Department of Agriculture confirms such gray areas can all be safe if you have respected a few basic food safety rules, which are essentially the same for fresh foods as for those thawed from frozen. If you do it properly, only food quality will suffer, said Donald W. Schaffner, a food microbiology professor at Rutgers University and a host of the podcast Risky or Not. Sounds like a good podcast. Is it safe to thaw and refreeze foods? Refreezing is perfectly safe according to the USDA. So long as the food was thawed in the refrigerator, the most foolproof method to keep pathogens at bay, Dr. Schaffner said. A quick thaw in the microwave or in a cold water bath is fine if you're cooking the food right away, but it isn't the safest for refreezing. The most perishable raw meats like ground meat, stew meat, poultry, or seafood should be refrozen within 2 days, and bigger cuts of red meat, beef, pork, lamb, roasts, chops, or steaks within 5. Previously cooked and then frozen foods like the remainder of the big frozen lasagna or a pan of enchiladas can be refrozen up to 4 days after thawing.
Okay. I'm not really big on refreezing stuff. I think every time, I don't know if you guys ever remember when, before we all bought actual ice packs, we grabbed the peas because nobody liked peas. For the record, I did like peas, but now I won't eat frozen peas because I'm always wondering if that's what they pulled out to use as their ice pack. And then they pull it in and out. I don't know if you've ever opened a bag of peas that's been unfrozen and then refrozen like 8 or 10 times. You don't want to do it. It's really gross. So that's a fun science experiment for the kids.
Yeah. You can make your own ice pack with rubbing alcohol and water.
Did not know that.
Yeah. So
Okay, label that as life hack.
1/3 rubbing alcohol, 2/3 water in a Ziploc bag. Shake it up, put it in the freezer, and it'll turn into a gel.
Shut up.
Yeah.
Oh my gosh, that's so fun.
That's your own personal ice pack right there. And then if you want it to be less solid, more alcohol. If you want it to be more solid, more water.
Okay, that's pretty cool.
Yeah, that's because I was a chemistry major in college. So
So fun.
Yeah, because alcohol doesn't freeze as fast as water does, so it turns into a gel.
So fun.
And they both mix well together. It's not like oil and vinegar. Alcohol and water mix well, so. But then the molecules don't freeze, but the other ones do, so it turns into a slush.
That is so cool.
It's pretty neat.
I'm
Yeah.
going to try it.
Okay. We've never done that at home.
No.
All right, we'll do it today.
You never taught science when we were homeschooling.
I didn't teach
I don't-
anything. when
I
we
don't
were
know
homeschooling.
why. So,
I teach Farsi. Is it safe to thaw and refreeze foods? Refreezing is perfectly safe according to the USDA. Oh, we did this one already. We did this one too.
does freezing.
Okay, so freezing pauses bacterial growth but doesn't prevent it. So be mindful of cumulative time spent in the danger zone. 40 degrees to 140 degrees Fahrenheit. That's the danger zone. So in between 40 and 140, bacteria will grow and have a party, especially when freezing and thawing more than once. No perishable food should hang out above 40 degrees Fahrenheit, for example, anywhere warmer than a properly functioning refrigerator for more than 2 hours total, or 1 hour total if the ambient temperature is 90 degrees Fahrenheit or higher. So you should thaw frozen food in the refrigerator. Foods that freeze well also refreeze well. Sounds like a saying.
It does.
You know, like nerves that fire together, wire together, or fire together, wire together. That's
Yeah.
what Joe Dispenza says.
So this is like raw meat, poultry. Their protein fibers are really resilient. The fat creates a protective barrier to slow ice crystals forming. Baked goods and breads and cakes are usually unfazed by freezing as well because of the starch matrix. So, which is different than the matrix we live in. Because I don't think we live in a matrix, but it's okay.
Yes. So, can you refreeze cheese and milk? Both cheese and milk become increasingly degraded in texture, flavor, and appearance with each freeze-thaw cycle. This was Dr. Guerin who said this. Cheese becomes drier, crumblier, and less flavorful, whereas milk becomes grainy, watery, and less smooth.
That does not sound yummy.
Miss Christensen's workaround is freeze dairy cooked into a complete dish like breakfast burritos or a custard-based mac and cheese. Interesting. I think
Very.
people just shouldn't refreeze.
Yeah.
Because I mean, it says it's safe, but the taste isn't as good.
I mean,
so.
we will cook something and then freeze it. That is something we do at
Right.
home. But we typically don't like take it out.
Well, sometimes we'll put in containers and freeze it so that when we take it out,
We're
we
only-
don't thaw the whole thing.
Correct.
We thaw what we're gonna eat.
Correct. Well, we do that when reheating food too, because that's it. It really has to do with reheating, not just like freezing. Also,
Yeah.
so when we have something in the we're a big leftover family. You know that because you live there. So we love leftovers because we don't have time to cook every night. It just
Leftovers
doesn't
are
happen.
so easy.
Yeah.
You don't have to cook, just grab it.
Yeah, we'll cook in larger batches and then we just pull out and heat up what we're eating. We don't reheat the entire dish and then put it back in the fridge and then reheat it again. We just pull out from cold, take the portions we need, heat that, and then so we're never reheating the same thing over and over.
Yep.
So that helps too. So strategies, just strategies.
So it says, is it safe to reheat food, then put it back in the refrigerator? It's only unsafe to reheat and refrigerate repeatedly if you are allowing the food to spend extended periods of time at room temperature.
See?
There's also a curious loophole. Every time we reheat leftovers thoroughly to 165 degrees Fahrenheit, the USDA gives us another 3 to 4 days to eat it, like wishing for more wishes. I don't get that analogy even. But there is a catch. With every reheat, more moisture is lost. Noodles and rice stiffen, and formerly firm vegetables meld into a slack, amorphous stew. That sounds appetizing.
Well, I think too, they talk about microwaves, and this is always, I don't know about you guys, but I always heard that microwaves are not safe for for reheating food
Yeah.
or for cooking food. So a lot of that comes from the plastics that we reheat, and you should never reheat in plastics. I would even say those that say they're microwavable, I would not be heating a plastic of any kind at all because it's
Microwavable dishes, what that means is that dish won't get damaged by the microwaves. It's not telling you that your food won't be damaged by the dish.
correct.
It's just saying the dish won't be it won't melt, it won't change
Yeah.
shape.
And unfortunately, we already know that the FDA allows way more in our food than what it should be as far as chemicals. And so I just don't trust it. Now, I tried to do some research to see, what effects do microwaves have on our food. They've done a really good job of and maybe it's true, maybe there's little to no effect. I just have a hard time anything that has any kind of radiation to it. And I know there's different kinds of radiation out there, but we're inundated with it. And we know that there's an effect on the body with Bluetooth, technology, with our Wi-Fi technology, with, we're just inundated. So I think if we can begin to remove some of that, it's never going to be a bad thing. So if we can maybe, instead of reheating our food through the microwave, maybe we can do it on the stovetop to create less,
Yeah.
because even if it's not affecting our food,
Molecular change, less molecular change.
yeah, I just think it's better. So it's tough to find, and there's a lot of controversial information when it comes to the use of microwaves. I would just say probably less is more
Yeah.
in this arena. So get out your
100%.
pans.
Yep.
But be careful what's on the pans. That's a whole other
There,
topic.
in this article, they had this chef talk about the things she does to trick people into thinking it hasn't been heated. Did you read that part? So Noor Morad, chef and an author, blah blah, recommends reheating dishes gently with a splash of water or stock if needed. Then doing a simple taste test. She'll stir in a spoonful of white miso or a grating of Parmesan for depth, fresh herbs or lemon for lift, or a sprinkling of toasted and crushed cumin or coriander seeds for oomph.
It's so funny because I'm reading that. I love to cook. I'm
Yeah.
not as much of a baker, but I love to cook. So she used perfect words. I was like, ooh, that does give it a lift. And that is like an oomph too. So I was totally on par with that last paragraph. I really, really enjoyed that.
Yeah, I didn't even highlight it because it didn't make any sense to me.
Right. Well, you don't do a lot of cooking. So
Lift is a different thing to me.
yeah. Yeah. That's,
It's what you put your car on so you can look under it.
yeah. It's also what you do at the gym
Yeah.
a lot. So,
All right.
well, we don't have too much more
We
time.
pick it up, we put it back down. Do you want to do 4 common infections that can cause
Yeah.
cancer? Guess what? This is from the New York Times.
Surprise.
Yeah, I should start reading other publications. Listen, that's not a political statement, please. A new report says that 13% of cancers are linked to bacteria or viruses. Vaccines and treatments offer powerful protection. Now, we know that there's a lot of controversy today about that V word. Most cases of stomach cancer are caused by bacteria. A majority of cervical cancers, as well as some genital and oral cancers, are caused by a virus, and a certain chronic viral infection can lead to liver cancer. There are effective vaccines and medications to prevent and treat these infections, and they can be detected early on through screening. So the first one they talk about is the human papilloma virus. There are more than 200 types of the HPV virus, including a dozen that significantly increase the risk of cervical, genital, and oral cancers. Most people infected with HPV will clear it on their own, but about 10% of women with HPV infection in the cervix can develop a persistent infection with a high-risk type. This can cause cells to replicate rapidly and inactivate proteins that suppress tumors, said Dennis Galloway, scientific director of the Pathogen Associated Malignancies Integrated Research Center at Fred Hutch Cancer Center in Washington. Most sexually active people will be infected with human papillomavirus at least once in their lives. And it says vaccination offers the strongest protection. I would say
Research this.
not having extramarital sex provides the best protection, but that's just my opinion.
The greatest, yeah. And please note that they did say truth at the very beginning of that, which was that most cases clear on their own. So our bodies were created to be able to get rid of these HPV cells that develop. There are cases where that doesn't happen, but it's not a very high percentage. So research this, because what I can tell you is that one of the creators of that particular vaccine, she actually came on and did a whistleblow on this particular vaccine. So do some research, see if you can find it.
I did do the research.
I don't know if they've ripped it out yet.
It has been taken down.
Yeah.
So it does not exist. You won't be able to find it.
It's a shame. Because she came out at when they were announcing this particular vaccine's existence, and she's like,
She basically said, and listen, don't quote me on this.
It's a paraphrase, but
this is hearsay. This you can't find the source to this information, and so I don't know if it's true or not. Apparently, she said because the HPV is self-limiting, the vaccine is not necessary. This is what they say that she said. Now, I don't know. And
do some research. You might be able to find it.
Do your own research and talk to your doctors, all that stuff.
But I would say dig into the data, because if our body does in most cases get rid of it, you have to then look at the risk that's involved, especially when we're including children in this request, especially since it's one that they do not say is required. Then you especially need to dig into that and do your research and ask for the insert before you give it to your kids. So
yeah,
nothing wrong with asking for the facts. You deserve that. You're owed that.
And it says most people are tested for HPV during a pap smear. So next one is hepatitis B and C. These viruses primarily lead to cancer by causing inflammation in the liver cells, said Dr. Sunyoung Lee, a gastrointestinal medical oncologist at MD Anderson Cancer Center in Texas. Chronic inflammation leads to a buildup of scar tissue in the liver called cirrhosis, which is a strong risk factor for cancer. In certain cases, hepatitis B can also directly cause cancer by altering healthy liver cells, Dr. Lee said. Hepatitis B and C can both be transmitted through contact with blood, semen, or other bodily fluids. In the United States, hepatitis C most commonly occurs among intravenous drug users who share contaminated needles. Doctors can detect both infections with blood tests. There's a highly effective vaccine against hepatitis B, and it can be it has been recommended to vaccinate infants against the virus since 1991. Adults up to age 60 and those of any age who have certain risk factors should be screened and vaccinated if they haven't already. There's no vaccine for hepatitis C, but not sharing needles is the best way to help prevent the risk of infection. Antiviral medications can cure hepatitis C, Dr. Lee said. So, yeah, that whole thing about infants. I mean, here it talks about, I'll read this real quick. Hepatitis B can range from an acute mild infection to a chronic infection. These persistent infections require treatment, including with antiviral medications, and in some cases, interferon, a protein that helps the immune system fight off infections. Because hepatitis B is commonly transmitted from mother to child, pregnant women should be tested. So, but I haven't seen any pregnant woman tested.
Yeah, we get tested.
for
was
hepatitis
tested.
B? Well, then why did they still give the vaccine to the baby?
That's what I was getting ready to, and that was one of my arguments and questions when we had ours is if I'm negative, then
And this
what is
baby
the
hasn't
true
been in contact with other babies' bodily fluids.
correct? Then what's the true risk of transmission at that point?
Right.
So for me, I go, is the immune system prepared for the adjuvant that's going to be given versus the potential benefit? Because for me, that's a big risk because we just don't know. There's a lot of unknowns.
Yeah.
And if the possible reward is not high enough, I just
We should, you know, what we should have done was found out what was the prevalence of hepatitis B prior to 1991, and what is it now?
right.
And I wonder what the difference is. So pretty much every baby. Now, I have been vaccinated for hepatitis B, but I was working at NIH in 1994. 94 and 95. I worked at NIH for 2 years, and we were dealing with body fluids, and they said you can't work in this lab unless you've had the hepatitis B, and it was 2 shots, I think 2 weeks apart, that I had to get. And at the time, I didn't know any better, and I didn't know any difference, so I got it.
Right.
But there are a lot of adults born before 1991 never had the hepatitis B vaccine. So I wonder what the difference is in that population. Are the others getting it more, you know?
Right.
And if it's
Well,
a sexually
Hep B is
transmitted,
a sexually transmitted, right?
Yeah.
And so I wonder if that came at the end of in 1991 because we're also coming off of the big AIDS
yeah,
awareness pathway
that was huge
which
in
was
the early 90s.
yeah 80s and 90s, and so I wonder if there was an increase of Hep B during that time, because we were a little loosey-goosey on our contraception and
Right,
whatnot,
and,
coming out of a sexual revolution, and
Right.
everybody was a little wheelie-neely with stuff, and it could have created an uptick in that. So I agree, you know, testing the mother to ensure that we're protecting the baby makes a lot of sense.
I agree.
If by chance the mother is positive and there's no way to protect the baby during delivery, then that could make sense.
Yeah.
But for a non-positive,
But then at that point, don't they already have it? In which case, shouldn't they do the interferons and the other treatments they talked about?
that's what I would think.
Because they've already been infected.
Correct.
So typically, the vaccines don't cure infections;
Correct.
they prevent them.
Correct. So it seemed, I don't know.
All right, but listen, we're not immunologists.
But
We're
we are
we're-
just saying
we're not
question it.
virologists. We're just asking questions
But
here.
you don't have to be either one of those to ask questions.
Right.
So when he says that, it's a protective mechanism to go, hey, you know, we aren't experts in this area. You don't have to be either. We have the right to question this stuff in our own health
Yeah.
and in the health of our children, as do you, and you should. Because we all know that there are plenty of times that we are asked to do something and it's not about our health.
Right.
And so because we know we live in a world where that happens often, it makes sense for us to be questioning things at a much higher level, especially when it comes to things that could definitely affect the immune system, affect DNA, any of that. You need to be questioning that, and no one should get upset. It is your health, it's your body, so you should be able to ask the question, and a provider should be able to give you an answer without any emotion attached to it. Right? Because it's your health and it's your body.
I promise you, most people don't have the answer to what we asked.
I'm sure
Which
they probably
is,
don't.
if the mother doesn't have it, why does the baby need the
Right.
vaccine at birth?
Yes.
Why can't they wait and do it later? Why can't they do it when the baby is at a sexually active age?
Correct.
And then what exactly are we preventing if the possibility of it doesn't exist?
Right. Well, you know, what's funny is I had one question at the very beginning. It talks about most cases of stomach cancer are caused by bacteria. And it talks about infections like these account for an estimated 13% of all cancer cases globally. But there's still, what, 87% that doesn't have to do with a virus. What we keep skirting around when it comes to cancer is that cancer is a lifestyle disease, which means majority of the time it's preventable by making changes in what we're doing and exposing our bodies to.
Right.
Now, sometimes there's exposures that we can't control. Those might be, it's still a part of your lifestyle. It might be outside of your control. But until we finally are willing to acknowledge that, we really don't have a huge possibility of decreasing cancer rates. And I believe that 100%, because we just aren't in a place in our culture where we're willing to own our activities that contribute to poor health.
Yeah, I mean, we can reduce it in the whole population by cleaning the environment.
Right. FDA.
That's what they did with, the Great Lakes when the fish were having cancer back in the 70s. They weren't radiating the fish. They just cleaned the water and cancer went away.
Correct. But it takes us years and years and years to discuss if the water is really contributing to a health issue. So if we want to spend all that time in a meeting discussing the potential health effects when it's very clear that there are health dangers in these chemicals in the water, we can't depend on the FDA to do it. They're not going to clean the water for us. They haven't done it yet. They're not going to do it now. Right? I mean, if the FDA is, you're welcome, FDA, to comment down below and let us know what your plan is. But as of right now, you're not showing us that that's what you have planned to clean up our environment at all.
Not when you're approving things like brominated vegetable oils and high fructose corn syrup and red food dyes, yellow number 5, and all of these things.
I've been driving the kids nuts.
Those are all approved by the FDA. But vitamin C is not approved by the FDA. So be really careful when you take vitamin C. But the red food dyes and all that stuff, you take as much as you want. They're FDA approved. The last one was H. pylori. H. pylori infections are very common. About half the world's population carries the bacteria, but only 1 to 3% of them will develop cancer. Scientists aren't completely sure why that is or how the bacteria actually causes cancer, said Nina Salama, Senior Vice President of Education at the Fred Hutch Cancer Center, who has studied H. pylori. The bacteria are found in saliva, the plaque on teeth, and feces. Infections commonly occur in childhood through close family contact or crowded living quarters, Dr. Salama said, and most people are asymptomatic. Now, I remember back in the 80s, or I think it was early 90s, it was big news when they discovered the H. pylori. And they would give everybody, started testing everybody and put everybody in a course of antibiotics. I think it was Cipro. So, and that was the fad. Everybody was on, and then they were like, okay, well, very few people who have the bacteria get any kind of disease whatsoever, so maybe we don't need to do that. But someone made some money for it. Yeah. The infection produces chronic inflammation in the stomach lining, which promotes cancer. Dr. Salama said the bacteria also bring toxic proteins into cells that can cause mutations. The strain of the bacteria and a person's genetics can also play a role.
Can we just say what he said was the infection produces chronic inflammation of the stomach lining, which promotes. So the chronic inflammation of the stomach lining is what promotes cancer. So just think about that, because think about everything you're putting into your body. Is that creating inflammation of the stomach lining? I will tell you that the majority of ultra processed foods create inflammation of the stomach lining.
Oh, yeah.
So we're doing it to ourselves every single day.
Absolutely.
I would
venture to say, this is just a guess, I'd venture to say that H. pylori is kind of like streptococcus.
Yes.
It's in everybody's throat.
Yes.
You have strep right now in your throat.
100%.
Everyone does. When it overgrows, becomes a problem. As long as it stays in check by your probiotics, by the good bacteria in your body,
your immune system
doesn't
is
cause
what he's
problems.
talking about.
So it says the best way to prevent H. pylori spread within families is to avoid sharing food utensils, drinking glasses, or toothbrushes when possible, Dr. Salama said. Washing hands well with soap and water for at least 20 seconds before preparing food or eating, as well as after using the bathroom will kill it. The United States does not routinely screen for gastric cancer, but people with stomach ulcers, stomach pain, or bloody stools should be tested for the bacteria. Doctors treat H. pylori infections with antibiotics and also often prescribe drugs that reduce acid and protect the stomach lining, she said.
Wow.
Well, there you have it. We only got through 3 articles.
it was a little
We had a couple
wordy
articles. One is on the new COVID vaccines that are being produced. They're coming out in the fall. It is fall now, so this is a little outdated, but it does talk about when you should take the vaccine and when you shouldn't, and some of the things experts. And then we also found an article about some people who say don't get it. So we thought we'd give you both sides of that, and if we have time, we'll do that next time, and we'll have some other information for you. So thanks for joining us very much. We love and appreciate you. We pray that you are blessed, and we will see you next week.
See ya.